numbers of people who are homeless. I'm not talking about people who are homeless with mental health issues, but just the large numbers of people who are homeless. I've not put all the statistics that started with Tamil Nadu because that's where we're located. And the other places that have large numbers of people who are homeless are Maharashtra, Gujarat, MP, UP, Rajasthan, West Bengal, and Karnataka.
The census is very much understated. So at least about 4 times.
And Harsh says that it's very understated.
25% of this.
Yeah, so it's at least about 4 times more.
Yeah.
Yeah. Okay, so now why homeless? Now this is a very difficult, for those who work with homeless people with mental health issues, I think we understand that it's a very, I see people over here who have worked, like Harsh, like Nimesh, like Tariq, like Ratna, like Ishwar Sankar, like Udu Mulangal. Now this is a very difficult area, and there are no, I'm not here to present solutions, I'm not here to say that this is a model and this is the right model, but I'm here to explore opportunities where we can reach out to this very vulnerable group in as sensitive a way as possible, because I'm not comfortable with the option of seeing them in the streets die or be abused or just ignored and just sit back comfortably simply because I don't have an option. So I think the reason that we are here together is to debate on what better way can we reach out to, or is there a sensitive way at all, or are there other options that we can provide in the absence of localized services, but we need to be clear about a protocol or a platform through which we can initiate a dialogue and look at how we can reach out to people who are homeless, particularly those with mental health issues, because I think they're the most vulnerable. So what are the common reasons? Poverty is something that we spoke of yesterday. We talk about people who are poor and we talk about BPL families, but what it really represents is people who don't have electricity, people who don't have homes, people who don't probably have 2 meals a day, people who do not even think of the concept of education, people who strive to have a glass of water. So these are all things that we take so much for granted. But our country has a large percentage of our population located in these spaces, rural and urban, who don't have access to these very basic facilities. Then where on earth does the concept of human rights appear from? So the people that we reach out to on the streets, or even the people that we reach out to in various communities, have these basic problems. So their problem really is survival. Their problem is not anything beyond that. 2 is, like I had mentioned yesterday, the lack of access to services. So the only model that we have now that reaches out to localized areas is the district mental health program. Now, if that is now existent in 125 districts out of the 627 districts, what happens to the rest? I know that Mr. Isaac spoke about how we have progressed from the time that it was initiated in 1982. But such slow initiation or such slow progress is simply not done, because what's happening in the absence of these programs is the result really is homelessness. Because the person is not able to access a localized facility, because the family doesn't know where else to go, the person most often ends up homeless. So we cannot afford to wait longer and say, well, it will take another 20 years or 40 years for the program to actually be implemented in various pockets across the country. So I see a key reason that people end up homeless is because there is a lack of localized care. 3, of course, a symptom of many of the psychiatric problems is really wandering. So several of the people who are in their homes are not in a position to stay at home because they're constantly wandering. The families try their very best, and I know that there was a mention yesterday of people being tied up or held back at home. Now, we may like to believe that the tying up or the holding back at home is a human rights violation. Sometimes it is, because the person is just tying up, the other person doesn't really care about the other person's reality or other person's existence. But very many times, it is true that the person cares. Like we had a referral from Jaipur. I don't know if Anubha is here, but we had a referral from Jaipur where this lady called all the way, I think it was rooted also through Anjali, where she called and she said, you know, there is these sand dunes and my daughter is simply unwell. I don't have a facility to go to, and unfortunately she's running to the sand dunes and I'm scared that she'll just go there and get submerged. I don't know what else to do because I have to go earn my salary, and if I don't do that, I can't care for my 3 other children who are also as young, and who, at least I want them to have a chance in life. I feel that there is no opportunity for her because I don't know where to take her. I only have a temple, a church or a mosque, and I'm resorting to exorcism, and again I'm spending money there as well. My husband is not supportive. Now, it's easy to pick one-off cases, but these are not one-off cases. this is the generalization. So I can very boldly say that whatever that I'm saying here is the majority of experiences in India, at least with many of the caregivers that we have gone through. So the tying, though not justifiable, is not because they enjoy doing it, but because they don't have any other option. If they were to leave her, she would perhaps get submerged, perhaps go kill herself by just banging into a train, perhaps get abused. There are so many things that could happen if the person didn't actually try to do whatever that was needed, even if it seems insensitive at that point in time. Housing seems to be a huge issue, even with people who are homeless. Forget about those with mental health issues, and Harsh is, I'm sure, going to touch on that. Stigma. So now we've noticed that there is a trend that in rural areas, stigma seems to be a lot lesser, whereas in urban areas, stigma seems to be a lot greater. So in the rural areas, really you have the community responding and you have people staying in the community, like Bhargavi when you visited the PC. You have the village over there, and the village is very, very accommodating of the needs of people, and they're open to differences, and there is a great deal of sensitivity. But as you move up the socioeconomic ladder, or when you exist in an urban society, we found, at least through our experience, that not very many people are comfortable having people with mental health issues or their caregivers live next door. And I was mentioning yesterday that there was a particular family that had to move 200 times. Is that right, Kotkudi? 200 times in a year?
And then they lived in an auto for a while.
And after that they lived in an auto for a while because they had no other place to live in, because people didn't want a person with a mental health issue to live just next to them. So they couldn't find a place. So now these are all realities, and because the stigma at a point, you know, this whole story of Madhu would tell me about there were floods. And at that point, she said that there was this woman from her village who was carrying a child, and she had along with her a goat as well. And she had 2 or 3 other children. So she mentioned that, you know, when this was the situation, and at one point she couldn't hold on to everybody, she just had to decide to let go of somebody, and she decided to let go of the child because the goat then would, for some reason, help in, I don't know what really the context was, but these are tough choices, and the reality is that India is in such a situation where people who are poor in the first place face a lot of difficulties, and those who are poor with a mental health issue, both the clients and the caregivers, face such complex issues that really have no solutions, or have solutions that are again very complex and not very clear. So there's constantly a need for a lot of debating, and of course it doesn't make you feel comfortable at all points. I mean, after having been in this for 17 years and worked with people with mental health issues, there are very many things that we ourselves have done which I'm not very comfortable with. But in the absence of other sensitive or more sensitive solutions, I really am several times left with no other option. And each time we come to terms with a reality that's harsher than the previous reality. So that is really the situation. Again, elderly, no caregivers, so death of the caregiver, the person is left abandoned, doesn't know what really to do, ends up on the street because there's no care available. And of course, you can't rule out the possibility of absolute abandonment. So it's not like everybody who comes to the Banyan has been taken care of by the families. It's not like the family is always willing to accept people back once we try the whole process of reintegration. It is also reality that